All right, hi, Paul Sackis, Good News Planet. We're going to talk about the serious subject, heart failure. 1 million Americans are hospitalized every year, and that's not good news. But good news is, how do we deal with things like this? We have Beth Davidson, a heart failure nurse practitioner in Nashville, Tennessee, and president of the American Association of Heart Failure Nurses. Hi, good morning, Beth. Hi, how are you?
Good morning. Excited to be here. Thank you so much.
Okay, and we also, and thank you. We love nurses. And Kim, hi, Kim. I'm crazy about nurses. Nurses are heroes. You're both heroes by far. Kim actually had heart failure, has heart failure. Well, Kim, what do you have?
Okay, so I have heart failure. I was diagnosed at the age of 32. Heart failure diagnosed at the age of 32, and I've made it 23 years.
All righty. How did you get, well, what happened to get you diagnosed? Was it an incident that occurred in your life?
It was a viral infection, and what happened was I had a cough and couldn't sleep, couldn't lay down flat. Went to the doctor several times. They couldn't figure out what was wrong. They sent me to a lung specialist who put me in the hospital. I spent 3 days in a coma and 48 days in the hospital on my first visit. Due to the chronic heart failure, I was told I had 5 years to live. And I spent many nights over the course of the next many years in and out of the hospital.
Wow. And so this is a very, very concerning subject. However, you're here today, beautiful, and open to discuss it. How come you're, so, you know, it's a big deal to share your own personal life with others. How come you're doing this?
Well, because I feel like there is a need to get this story out there. People need to know that you can get help, that it can be misdiagnosed, and just go and get help and what to do, and that you can live a normal life once it's being diagnosed.
Is there any one comment you would say about potential misdiagnosis? There was something that you learned there that you would say to some doctor, how about this? Do you think it might be heart failure? Do you think, is there something that happened to you?
I think you have to be very aware of what's going on with your body. At the age of 32, I was a single mom. I was busy working full time. I kept taking what my doctor said, and my doctor should have known, but I never thought to ask him to check my heart. I didn't know there was any such thing as chronic heart failure. Again, I was 32 years old. I'm not supposed to have heart issues, so I didn't know it would happen to me. A heart issue happened to an older gentleman, so not to a young woman.
Okay. Wait, that might be my category. Beth, first of all, nursing.
Sorry.
Thank God my heart is okay. Beth, so could you tell me what's a heart attack and a heart failure? Do you know the difference? Or are they the same?
I do know the difference.
Okay.
Very different. Very different. A heart attack is where you get a blockage in one of the blood vessels that feed the heart. Heart failure is a more chronic, progressive condition where the shape and size of the heart changes and it's not able to pump enough blood to the rest of the body, or the pump isn't as efficient as it should. Because of this condition, you get a lot of symptoms, primarily related to this holding on of fluid. So patients can be short of breath. They can get a fluid in their belly or their abdomen. They can get swelling in their ankles and feet. And when these symptoms get severe enough, guess what? They come to the hospital for relief. So they come to the hospital, we treat them, they get better, they go home. But lo and behold, about 1 in 4 of these patients end up coming back to the hospital within a month for the same symptoms. So in the time of the pandemic, as healthcare systems are already overburdened and these patients are already at risk for heart failure, we're trying to do everything we can to minimize that risk right now.
Okay. And so what are some kinds of approaches to do that?
Sure. So we want patients to engage with us. We need you to be a participant in your care. So a low sodium diet, as Kim mentioned, stay as active as you possibly can, get some sleep, follow up with your healthcare team, and take your medications as prescribed. And Kim and I are here today actually on behalf of Novartis to talk about heart failure, but also a medication that is specifically designed for patients with chronic heart failure, adult heart failure patients. It's a medication called Entresto, and it recently just got approved for more patients with this diagnosis. So it's very exciting for those patients. It helps decrease these hospitalizations I spoke to, as well as decreasing the risk of death. And it tends to work best when the heart can't pump a normal amount of blood to the body.
Is that what they call the injection factor?
Ejection fraction, exactly. Is the amount, you're so good, is the amount of blood that is pumped out with each beat. So I think it's important to talk to your doctor to see if this medication is right for you or fits into your regimen, because, you know, like most of the medications we take, it's not a panacea. It's not the right drug for everyone. So if you're a female who's pregnant or becomes pregnant, if you're taking an ACE, an ARB, or aliskiren, or you have angioedema, which is a severe allergic reaction of your face, your nose, and your mouth, this is not the right drug for you or medication for you. So talk to your healthcare team to see if this makes sense for your personal story.
So I'm a little knowledgeable only for not a good reason. That's a loved one had a heart attack. And because of this heart attack, because caregiving, taking care of her mother, older, you know, my age, the stress, as you spoke previously about stress and so on and so forth, I think I hurt her badly to the degree of a heart attack after a couple of years, you know, and between, you know, taking care and people coming in and taking care of, not going into a nursing home scenario, wanting to stay your last days of your life at home, you know what I'm talking about. And it's a very difficult scenario because everybody gets old. Everybody, you know, say 50% doesn't do well. You know, it's not a perfect ending here. And so these things do come up, right? Like you're saying, you would go from 6 million to 8 million. So more people will have heart failure, you think, in the coming years?
Yeah, one of the risk factors is, you know, the chances of heart failure increases as you get older. So as our baby boomers peak, our numbers are going to go up. And you're right, it's a challenging situation, and it's a burden for patients and for caregivers. So there's a lot of information out there. You want patients to get the right information. If they ask, send them to entresto.com. They can get information about this disease, risk factors, signs and symptoms, and some of the safety information we mentioned as well.
How do we spell Entresto?
Entresto. Entresto.
Entresto.com?
Yes, sir.
Okay, all right. So
accurate, reliable information.
Okay, good. And tell me, I mean, you did mention, you know, single mom, stress. So now, you know, years later, living, you know, with the knowledge, I guess you gained that stress was very detrimental to your health. How do you handle stress?
Well, I stay on medication that Beth has mentioned, and so there's been no hospitalization, so that kind of de-stresses things. And I've just learned to live a happy life, but everybody has different experiences. Thank you so much for asking all these wonderful questions.
You two are both heroes. Thank you so much for sharing with us. Speak with you again. Take care. Bye-bye.
Thank you so much. Have a great day.
Bye-bye. Thank you.